In this podcast episode, Dr. Michael Breus, a renowned sleep doctor, delves into many common sleep issues and misconceptions, sharing practical advice for improving sleep quality. Topics range from the pitfalls of trying to catch up on sleep, the biology behind waking up in the middle of the night, and sleep-disrupting habits, to more specific areas such as sleep apnea, the impact of age and menopause on sleep, and how lifestyle, supplementation, and behavioral techniques can support better rest. Dr. Breus also offers insights on managing sleep challenges faced by shift workers, pregnant women, children with ADHD, and those suffering from restless leg syndrome. Dr. Breus explains that one of the biggest mistakes people make is rigidly aiming for 8 hours of sleep by staying up late and then sleeping in to compensate. This disrupts the body's circadian rhythms because the wake-up time essentially sets the timing for melatonin production, the hormone responsible for sleep initiation. Variable wake times cause variability in melatonin release, creating sleep difficulties. While getting less than ideal sleep one night isn't catastrophic, consistent disruption can be problematic. He emphasizes that about 5.5 to 6 hours of sleep is a minimal lower limit, and that mental state plays a major role in sleep quality. He estimates 75% of sleep is influenced by what's between your ears. The discussion turns to Dr. Breus's 5 sleep traps. Living out of sync relates to ignoring circadian cues like waking up and going to bed at inconsistent times. Playing catch-up involves trying to compensate for sleep debt on weekends by sleeping in excessively. Moderate catch-up of 30 to 45 minutes is okay, but sleeping in by several hours leads to social jet lag, where the body's internal clock is out of sync with the weekday schedule, worsening Monday mornings. Freaking out about sleep problems, getting anxious about waking up at night, or insomnia only worsens sleep by increasing heart rate, core body temperature, and anxiety. Instead, relaxation techniques and a mindset similar to how we approach love, that is, the less you look for it, the more it shows up, are encouraged. Dr. Breus draws a comparison between how nutrition knowledge was traditionally handed down within families and cultures to how sleep knowledge once was. Modern life, with artificial light, like the invention of the light bulb, electronic devices, caffeine and alcohol consumption, and irregular schedules, interferes with natural sleep processes. People often create hurdles to good sleep unwittingly. Basic advice: going to bed when tired, waking with the sun, exercising, and hydrating remains effective but is sometimes overlooked in modern society. While most sleep issues can be improved with behavioral changes, certain conditions like sleep apnea and narcolepsy require medical evaluation and treatment. Dr. Breus highlights the common fear many patients have of sleep testing, especially the worry about being prescribed a CPAP machine that involves wearing a mask at night. However, sleep apnea treatments have expanded beyond CPAP and include oral appliances and surgeries to open airways. Dr. Breus candidly shares his own experience with moderate to severe sleep apnea despite not fitting the stereotypical patient profile. He is neither overweight nor a heavy snorer. His story encourages listeners not to dismiss symptoms or avoid testing out of fear or embarrassment. Sleep apnea is characterized by repeated pauses in breathing during sleep, often caused by airway obstruction from relaxed tissue, enlarged tonsils, or structural issues like a deviated septum. Common signs include loud snoring, morning headaches, daytime fatigue, mood swings, and difficulty focusing. Diagnosing sleep apnea can involve in-lab or at-home testing, and treatments aim to keep the airway open using CPAP devices, oral appliances that move the jaw forward, or surgery. Weight loss can help, but is not a guaranteed cure. Dr. Breus explains that waking up in the early morning hours is a normal biological phenomenon linked to the body's core temperature cycle. The body cools overnight, reaching its lowest point between 1 and 3 a.m., which naturally causes brief awakenings. Most people return easily to sleep, but 10 to 20% struggle to do so. He advises against immediately getting up to urinate unless absolutely necessary, as standing up raises heart rate and temperature, hindering sleep. Checking the clock or phone to see the time can induce anxiety and worsen waking. Instead, he recommends relaxation techniques like 4-7-8 breathing, progressively inhaling, holding, and exhaling to reduce heart rate and calm the mind. Other strategies include visualizing numbers to distract from monkey mind, the busy mental chatter that can keep people awake. Even lying still in bed, practicing non-sleep deep rest, such as yoga nidra, can provide restorative benefits if sleep is elusive. A key point made is the value of creating a power-down hour before bed, divided into chunks of time for completing tasks, hygiene rituals, and relaxation. Quiet, low-stimulation activities such as reading are preferable to screen time or intense mental engagement, which can interfere with the body's wind-down process. Adults often forget to set routines akin to the bedtime rituals that help children transition to sleep. Establishing predictable cues conditions the brain to associate certain behaviors and environments with sleep. Sleep architecture naturally changes with age, especially after 55, when deep sleep decreases and brainwave patterns shift, requiring altered clinical interpretations. Dr. Breus notes that older adults often have greater sensitivity to stimulants like caffeine and depressants like alcohol, even if these were tolerated better in youth. Menopause introduces further changes. Hormonal fluctuations raise the risk of sleep apnea, making testing essential. Hormone replacement therapy, HRT, can positively affect sleep by restoring progesterone levels, a hormone that aids sleep, dispelling earlier misconceptions about cancer risks associated with HRT. Managing caffeine and alcohol intake becomes increasingly important during and after menopause. Wearables like Fitbit, Apple Watch, and Oura Ring can reliably estimate when a person falls asleep and wakes up, but are less accurate in measuring sleep stages such as deep and REM sleep, which require brainwave EEG data. Dr. Breus advises users not to obsess over daily sleep scores, which can vary in accuracy, but to look instead for trends over weeks. These devices can, however, be useful for raising awareness, for example, showing the impact of late-night alcohol on sleep disruption. Heart rate variability and oxygen level trends on wearables may provide clues to undiagnosed sleep disorders like apnea. Unstable blood sugar is a frequently overlooked cause of night awakenings. Eating high glycemic foods before bed can provoke blood sugar spikes, followed by drops that trigger cortisol release and wakefulness. Continuous glucose monitors, CGMs, can help individuals identify personal food triggers and avoid evening blood sugar volatility. Maintaining steady glucose supports better sleep and overall metabolic health. Hydration timing is also critical. Drinking large amounts close to bedtime can cause nocturia, thereby disrupting sleep. Shift workers face unique challenges as their waking hours conflict with natural circadian rhythms, increasing risks for mental health issues and mortality. To mitigate this, Dr. Breus recommends maintaining consistency in sleep and wake times as much as possible, having a cave or dark, quiet space for daytime sleep, and using tools like apps that optimize caffeine and light exposure timing. Pregnant women are encouraged to maximize daytime and second trimester sleep, as discomfort and hormonal changes disrupt third trimester rest. Children with ADHD may have worsened symptoms when sleep deprived. Medication timing and establishing good sleep routines are important. Restless leg syndrome, often linked to low ferritin, a form of iron, can be alleviated with iron supplementation if levels are low. Distraction techniques and avoiding late caffeine also help. Supplementation is best guided by blood tests. Magnesium supplementation helps if a deficiency exists, with magnesium glycinate favored for its gut tolerance and additional sleep-promoting glycine. Vitamin D and iron are also vital to check. Valerian root, sometimes combined with hops, is a well-studied herbal option for relaxation. Regarding prescription drugs, SSRIs can cause sleep fragmentation depending on the medication and timing. Adjusting timing or switching medications under physician supervision may improve sleep. Dr. Breus emphasizes that sometimes sleeping pills are a necessary therapeutic tool and that some sleep, even if medication-induced, is better than none. To combat pre-sleep anxiety or monkey mind, Dr. Breus endorses techniques such as 4-7-8 breathing and cognitive distractions like counting backward in threes from 300 or mentally spelling out words with associated lists. These exercises are designed to occupy mental resources and reduce anxiety, enabling sleep processes to take over. Starting the day with a deliberate routine, such as 15 deep breaths, drinking 15 ounces of water, and getting 15 minutes of sunlight, helps set circadian rhythms and promote alertness while preparing the body for the coming day. Light exposure in the morning helps regulate melatonin timing and clears morning brain fog. Familiarity in sleep environment is important. To combat the first night effect experienced when sleeping in unfamiliar places, Dr. Breus recommends staying in the same hotel and even the same room when traveling for work. Bringing personal comforts, such as a favorite pillow, eye mask, earplugs, and tools to darken rooms, can replicate home conditions and reduce sleep disruption. Dogs in the bedroom may also enhance sleep quality for many people, contrary to common assumptions. Maintaining ideal bedroom temperature and considering climate-regulating sleep products further supports better sleep. Parents can positively influence children's sleep habits by mimicking the routines and environmental cues, like dim lighting and quiet times, that help them as children transition to sleep. Creating a darkened atmosphere in the home before bedtime encourages the natural hormonal cascades that promote sleep, improving not only children's rest, but also their performance in activities such as exams. For individuals with unavoidable extreme sleep deprivation, such as full-time carers getting only 3 to 4 hours of sleep, Dr. Breus acknowledges the significant health detriment. While longer sleep is always the goal, strategic short naps and deep rest techniques can provide some mitigation. Being mindful to protect these moments with safety and awareness is important. Those who consistently wake up exhausted despite seemingly adequate sleep should consider evaluation for conditions like sleep apnea, narcolepsy, or depression. Ongoing daytime fatigue and cognitive difficulties often hint at underlying disorders that benefit from professional diagnosis and treatment.